Good morning, everyone, or good afternoon if you're not on the West Coast. Today we're going to talk about two kind of heavy topics that gets floated around the industry, and yet no one is on the forefront out there braving the discussion, mostly because they're large, challenging, complex issues. And one of them will still have to just wait and see what comes down the pike. But we'll go ahead and get started. So elephants in the room. Today we're going to talk about two fairly heavy topics. Like I said, one is scalping, and then the other topic is, of course, nano-emulsions and what that means from a regulatory perspective. But the first topic, scalping, there are some truths, there's some half-truths, there's some misconceptions, there's a lot of misinformation out there. This is a very real phenomenon, and it's been around long before the advent of CBD beverages. We've seen this especially in the beer industry. So many beer manufacturers that choose to put their products in cans will have some scalping effects over time. The mechanism is essentially that some of these aromatic compounds or have an affinity for the liner on the inside of the can. So most people are familiar that there is a liner on the inside of the can, specifically for low pH beverages. Anything that's lower pH would attack the aluminum and eventually eat its way out. So they put a can liner on. And years ago, they used to use BPA. That was the preferred crosslinker for the chemistry of the can liners. Obviously, with BPA being what it is and its side effects, the industry was essentially forced to remove BPA as the crosslinker for the can liners. And now they use a less efficient crosslinker. You get less crosslink efficiency, and you have more active sites left. And these active sites are what attract the molecules. In beer, it's the terpenes and hops. In CBD beverages, it's the CBD and the terpenes associated. But the good news is there is a way out. Like I said, what happens then in the beer industry, it's not that big of a deal. Essentially, your beer doesn't taste as fresh or as good as it possibly could. But in the CBD and cannabis world, where we're held to labeling standards and hitting accuracy on our labels in the milligram area, if you have a change in the level of CBD or associated terpenes that are attaching themselves to the can, you're going to have lower assay values, and that's just what it is. So there's number of ways to mitigate it. Usually the general rule of thumb is that some people will overdose their cans to account for the scalping. It becomes a cost issue, and then you also don't want to go too heavy because then you're way out of balance for what your stated label claim is, and you're essentially giving away money. The challenge really exists that in the can predicament that we find ourselves in right now, where no one can have a concentrated, definitive supply of cans. They get the same product, the same lot, the same construction time and time again. People are buying essentially what they can get their hands on. You're losing control of one of the driving factors, which is the cans. Not all can liners are built the same. There are different thicknesses. There are different chemistries. There's a lot of variation in there. So you really don't have a good understanding of what you're getting. The other thing that complicates matters is that every formulation scalps at a different rate. And you could literally only change the flavor systems in your beverage, and you can affect scalping to a different degree. So then you can complicate matters by having terpenes for flavors and pH differences and carbonation differences. All these things drive the scalping. So there unfortunately is no silver bullet to fixing it, and no no spreadsheet where you can plug variables in to calculate what your scalping is or isn't going to be. It's just through experimental design and testing where you have to determine this. So this is essentially what we're saying is that there is essentially no standard in can liner, so you can't predict a standard curve for scalping. There are some can liners that we see are effectively better at scalping than others, but that's also driven again by formulation. Now we know that glass and plastic don't seem to exhibit this scalping phenomenon, which is great. Unfortunately, glass and plastic, one with plastic, and we already have enough plastic in the environment, and people are starting to knee-jerk away from plastic, and that makes sense. Glass has the weight issues, the logistics issues, the shipping issues that go along with glass. Really, and in the pack it in, pack it out mentality right now, the can is still the preferred method. So we know that it's going to occur or can occur. So how do we help? We can design systems and test systems so that we can help predict what your scalping could be if we can secure a specific source of cans and we can work with them in advance. Then there's a mechanism by which we can assist our customers in helping figure out what the scalping is, how much it's going to occur, how each formulation does it. Then we also work with different vendors and co-mans that have some methods to employ to help minimize scalping. Unfortunately, they're a bit of a trade secret for some of our co-mans, so we can't really get into the how's and the what's and the why's they do it, although there is some producers that have a much lower degree of scalping than others. The good news is we have the whole team here that help work on it between the R&D group and the manufacturing group and the analytical group. So we've got a ton of experience behind it to help drive your level of understanding for scalping at your particular system. We'll get into, we're going to do a bit of a nano primer. The pole being what it is, nano is 1 to 10 to the negative 9th meters. So how small is that? It's really small. Your red blood cells can be between 10 and 20 nanometers. It's this really fascinating topic that we see all over the place in the cannabis industry. And everyone is touting nano-emulsions, and I don't necessarily think they have. What they're doing is they're touting their tech, and they're touting the ability to make really, really tiny particles. But if you can see down here, when we get into the nanometer range, we're starting to talk about the size of DNA, red blood cells. That means these things are so small that they're going to be able to move around in your body just like DNA and red blood cells. Is that necessarily a good thing? Usually the FDA says it's a little apprehensive about that type of product. Essentially, nano is just simply a marketing or buzz term. There has been an attempt to classify what nano is. The FDA has gone on record in many publications saying that the way they look at nanotechnology is in the 1 to 100 nanometer range, but that's not concrete, and it can actually go above the 100 nanometer range. It is essentially a buzzword created by industry for people that know more about their technology and marketing than they know about the FDA regulations. That is the challenge. There's no definition around identity for nano, but if you can make something that's 999 nanometers, you can call it nanotech. It's essentially 0.999 microns, but it gets thrown around a lot. The FDA a few years ago created two working groups. One is inside the FDA. It is called the Nanotechnology Task Force. So the creation of an internal unit inside the FDA means to let you know that they take this stuff pretty seriously, and they take a really, really hard look at nanotechnology. In concert with a number of different agencies, Department of Ag and Commerce, there's also been created something called the Emerging Technologies Interagency Policy Coordination Committee. God bless bureaucracy, right? They've created this huge working group with interagencies within the federal government and with international agencies. Part of this is that this group was developed to give special attention to two new areas. One is essentially nanotechnology. The other one is synthetic biology. So this is really at the forefront of the FDA and the FDA's attention. I would strongly advocate for anyone that's interested in looking at nano or thought about looking at nano, or you really have to do due diligence and go through the FDA. And they have a ton of great resources out there for great information for folks. So where does SōRSE stand on nano? Well, we always as a company put consumer safety first. That's our number one priority, safety and quality. We do not tout nor sell our products as nano. And the primary driver behind why we choose not to label, use, or create nano products in marketing is it will likely subject you to some level of scrutiny by the FDA. Whether it's in the form of a pre-market approval for materials, many statements in the documents put forth by the FDA say that if you're planning to put a product on the market using nanotechnology, they would strongly advocate you talking to the FDA first before you do so. So there are some inherent regulatory hurdles, burdens, and risks that come along with using nano or the word nanotechnology. There are some myths out there. They tout them as all nanotechnology is clear. That's not true. There are a vast majority of them are, but not every single one. When they talk about bioavailability, many people will talk about because the molecules are so small, they're more readily absorbed into the bloodstream. Again, not necessarily true. There's some caveats to that. If the system can't survive the first pass metabolism of your body and breaks the emulsion, the oil is simply not in an available state and will reaggregate. So the other caveat is the companies will tout to say a nano-emulsion is bioavailable in 5 minutes. Great. Does it have to be available in 5 minutes? Can you wait 6 or 7 or maybe even 10? No one expects their Tylenol to work in 5 minutes. You will get the effects, no problem. And if it happens in 3 minutes or 5 minutes, does that categorically give you an advantage, or would you rather choose a product that touts that? And how do we measure that? How do they actually have data? Because the other thing you'll see is there's a lot of claims, but zero substance to back up the claims. Because of the FDA involvement, nano it has a special category. It is not immediately approved by the FDA under the current standards. And if you choose to use products that are nanotechnology or market them, it's very likely, and if you haven't done pre-market approval with the FDA or contacted the agency in some manner, they may come back to you and ask you for supporting data, safety data. A lot of information potentially could cost you a good bit of money in the development or having to recall product. It's going to cost you a lot of time to do all of the work and develop all the data sets and put the packages in front of the FDA. And then of course you have to wait for their approval, and then they may come back with more questions. So it potentially puts a lot of hurdles in front of a company that would choose to use it. And you may be asked to reformulate. That's the truth of the matter. They may come back and say, we're not approving this material Because remember, in the current state of the FDA, with GW Pharma having a patent on CBD, CBD still technically falls as a drug, and a nano-sized drug certainly falls under the scrutiny of the FDA. So one thing we have to pay attention to is product developers and formulators, and you can't, like, it is cool marketing, without a doubt. It is super cool to be able to put like nano stuff on, and it looks cool, it reads cool. But what does it do for you? It is great for marketing, but it does carry with it some concerns, some regulatory concerns, some costs concerns, some development concerns, some safety and efficacy concerns. We still don't know yet what the FDA is even going to say to CBD in food. So that's the higher level question that's still yet to be answered. So now, once it is approved for food, are they going, in what form or factor are they going to approve it? Is it going to be broad or isolate? Is it going to be nano or micro? We just don't know yet, but eventually all of these things will shake out. When we hate to be caught behind the 8 ball of having to do a lot of reformulation. And the scary part is, there are some sizes of nanomaterials that literally can enter the cell and enter the nuclei of the cell and disrupt replication of DNA, transcription. You never want to put something in front of consumer, because even if it's proven not to be, the litigious society that we live in, some lawyer may get their hands on material and find out what's going on. One patient gets sick and now there's a class action suit. So there's a lot of stuff. It's not meant to be scary and the world is burning, but it's just, when you get into these regulatory environments, it is absolutely critical that you do due diligence, you get consultants, you brush up on what the current thinking, read the briefs by the FDA. This is going to be viewed by the FDA as a pharmacologically active substance, much like caffeine is. And while we can drink as much caffeine, there is still scrutiny. And so that's where all customers, SōRSE and all of our customers, need to put our consumers eventually first and foremost to make sure that they're being safe.